There are three things that you need to know when it comes to Medicare and your retirement. The first one, what is Medicare? And the big decision between Medicare Advantage versus Medigap, which one's the right fit for you? You also need to know what Medicare does and doesn't pay for. And then lastly, how income impacts your Medicare Part B premiums. So first, let's talk about the first one. What is Medicare? What does it cover? And let's talk a little bit about the Medicare Advantage versus the Medigap or supplement decision that we have to make. So, Medicare is our health insurance throughout retirement. And when we're building out our plans, we need to figure out, should we go with the Advantage, also known as Part C, or should we go with supplemental, which means we have Part A and B and then fill the gaps with supplemental insurance. So the decision here, they both have different pros and cons. For Advantage, here we might have low or even no monthly premium. So very inexpensive as we're going and as we're staying healthy. But the drawback, if we get sick, we may have higher copays. If we work with doctors outside of our network, we may have higher copays. So it's a nice plan when we don't need care, but if we do need it, it might cost us more. Then we have Medigap, the exact opposite, where here we're paying monthly premiums for this, but we have more control of what that copay and what our deductibles may be. So it might be more expensive each month as we're healthy, but when we get sick or we need to use this care, it's there for us and it's more predictable in what comes out of our pocket. So last thing to hit on these is the access to doctors. Know that Medicare Advantage is a lot more restrictive, whereas Medigap Supplement, we've got a lot more options when it comes to the doctors that we use. With anything, it's always worth talking to a healthcare or Medicare professional on picking which plan that you use in those. The second big question is, what does this stuff even cover? If I get sick, does it cover me? If I need long-term care, does it cover me? If I go to the doctor, does it cover me? So to answer that one, know that this is our medical insurance. It's our health insurance, meaning it'll pay for those doctor's visits. It'll pay for, surgeries that we're recovering from. It'll even pay for some hospice care as well. But one thing, the common misconception is Medicare does not pay for long-term care. It doesn't pay for the nursing home. It doesn't pay for assisted living or even in-home care. The common misconception is sometimes Medicare will cover the beginning of these stints. The rules are Medicare will cover the first 90 days of long-term care as long as you're getting better. But the moment your health plateaus or if it's going down, Medicare will stop paying the bills and you're on your own to start paying for the nursing home and assisted living. The third big question, income, right? How does this impact our Medicare? And it makes a big impact on our Part B premiums that we pay every month. So the base rate for Medicare Part B this year in 2023 is $164.90. That is for each spouse is paying that premium in. But that premium changes for you if you start making too much money. So if you make, as an individual, $97,000 a year or less, then you pay that base rate. As a married couple, it's $194,000 in income or less, you pay the base rate. But the moment your income starts to exceed those levels, goes to $200,000, $220,000, $250,000, now you're going to start paying more for your Part B premiums. So on the surface, that you thought is, let's avoid that. Let's not get to those income levels. But remember, with tax planning on the IRAs, that's paying income tax. And sometimes the tax savings of jumping into that first or second ring of paying more for Medicare Part B can be worth it. We might save $10,000 or $20,000 in taxes to pay a few extra hundred when it comes to Medicare. So if you've got questions on it, a tax map is the tool that you need to tell you more about how much you should take out of your IRAs. Is it worth going further into that Medicare world? And also we look at our income tents when it comes to the healthcare costs and how we can build those costs into every retirement plan. If you found this video helpful, please like and subscribe.